guys, so it's March, International Women's Month, so I'm kicking off with a video for my new or relatively new mums. I've got 2 kids of my own, so I understand just how difficult navigating, the first part of babydom, 4th trimester is, and I've had a request to do a video on combating fatigue after baby. Welcome to Life of Dr. Candy. I'm Dr. Candy, and I'm bringing you little actions that make a big difference to your overall health and wellness. So let's just think about it, okay? That last trimester for most women, or if you're me, every single trimester, is physically and mentally draining. Then add a sometimes extended labour and a difficult delivery, and then the actual hard work of looking after the child that you birthed. It's no wonder our bodies are zonked, knackered, post-apocalyptic. I mean, every time I was asked, how are you? And believe me, after a while, that question grated after running on 0 hours sleep. My answer was always, je suis fatiguée. I am tired. I always mention my first a lot because I was naive and oblivious for the most part, but I feel like I've implemented some key changes that meant by the time I had my second child, I was a lot better prepared. So let's get into it. Firstly, for the more medical reasons, apparently over 50% of new mums are anemic and have a low level of iron. There are so many reasons for this, from pregnancy to diet to excessive blood loss during delivery, and symptoms can range anything from dizziness, chest pain, cough, palpitations, increased rate of breathing, increased heart rate, and tiredness. An underactive thyroid gland can sometimes cause tiredness, as well as a host of other symptoms, so that's something to be aware of as well. And personally, after my first, I was on some prescription medication for the pain, like codeine, and these medications often make you feel really tired and drowsy as a side effect. And I get lots of patients who sometimes feel sadder than usual, maybe more than they'd expect, crying because of really small things, mood swings out of what's expected as a new mum, and just not really feeling themselves. I think it's important then to contact your doctor straight away, because this can be a result of baby blues or postpartum depression. In the interim, whilst you're awaiting an appointment, you can complete something called the Edinburgh Postnatal Depression Scale, and that gives you an indication as to how bad things really are. There are non-medical reasons as well. So breastfeeding is exhausting. Feeding a baby and being the sole provider every few hours for the first however many months is so much more draining than it looks and requires a lot of energy. 500 calories a day to be exact. Do you know how much exercise that is? That's like the equivalent of a Zumba class for an hour, or tidying your house non-stop for 2.5 hours straight. So it's understandable why breastfeeding mums particularly, are just tired. Did you know that a new mum's brain actually shrinks in size after pregnancy? And they say it's just to filter out all the noise and all the unnecessary things, so that mums can really focus on nurturing and the survival of their baby. And this apparently can last up to 2 years. Can you just imagine when you're a mum that you are just constantly on high alert? You spend every waking moment thinking about another human being, making decisions, and just worrying. Your brain operates at full capacity, going from one thought to the next, to the next, to the next, to the next. It's mental. It's really, really hard to switch off. I went from being able to sleep anywhere at any time, I kid you not, I once slept 17-hour flight with my best friend, to now waking at the sound of a pin drop. Ugh, the woes. So as well as fatigue being a sign of depression, being overly tired can just lead to low mood and depression in itself. So it is really important to address it. Fatigue also affects your stress levels, and that can have a knock-on effect on your relationships, including your partners, your loved ones, and your baby. And it also makes it really difficult to handle those everyday tasks and situations which you ordinarily would be able to handle. Tiredness also, when you're breastfeeding, can lead to a low supply, and it can even lead to breast infections called mastitis. Inevitably, just running on empty for too long leads to burnout and can have really unfortunate consequences. Well, I say all of the negatives of being tired, but of course I think it's also reasonable to state and highlight that a certain amount of tiredness is expected after everything that we've listed that women go through. After about 6 to 8 weeks, you'll probably have your first assessment by your GP or your doctor, and they would expect that your uterus would have shrunk back to pre-pregnancy size. But in terms of recovery and settling in, I think you're far from being back to yourself, whatever yourself is. I would say that it takes at least like 3 to 6 months at least, and it's really important to be aware of that so you can brace yourself. It's a marathon, not a sprint. Sleep when baby sleeps. I know you've heard this a million times. Honestly, this is so important. I don't even know how and in which way to stress this. Did you know that the average mom survives on just 3.5 hours sleep a night for the first 4 months? So go to bed early, go to bed at 10 a.m., go to bed at midday, go to bed at 4 o'clock, and again. Sleep as much as you can and as often as you can, because it all adds up, especially when you have just one child. Drop the Hoover. I don't know who needs to hear it, but just step away from the sink. Just let it go. Tell me, if someone had come back from surgery, would you really expect them to be doing household chores? I mean, the problem is the way we frame this postnatal session, and it's everybody. It's like, I would say, live like a nomad. Just really simple. Don't be a slob like me and utilize every room in the house, which inevitably means I have to tidy up, and every room needs cleaning. Just keep the mess simple. Contain yourself. Use disposable, recyclable cutlery and plates, etc., to reduce your washing. Use laundrette services to wash your clothes for you. There are so many ways to simplify the process. You just have to take a moment to think about them. My friend prepared meals for weeks before her baby was born, bought a massive American-sized freezer and froze them. I mean, I still wish I had that level of insight. Amazing. Remember, our brains have shrunk, so you can't still try and take on all the same amount of chores and everything that you were doing before. It just won't work. So if you have help in a partner or a loved one, fantastic. Let's get specific. Use them. What can they do consistently that would make things easier for you, even if it's just one small thing, like cooking a meal or always changing the diapers or giving baby a bath? I asked my husband to just let me take one uninterrupted shower every morning. It meant so much to me. It didn't always happen, but gosh, when it did, it worked wonders to my psyche. And then he wanted to give me that shower every morning. If you can afford a cleaner or a nanny, or if you're lucky enough to have family members around to support, just utilize them, even if it's just for a week or a month. Every little helps. Now, remember how I said breastfeeding utilizes about 500 calories a day? Well, the best thing you can do to regain your energy is to eat nutritious, wholesome, healthy, well-balanced meals. Drink plenty of fluid and get those calories back to even out your losses. I would recommend continuing your prenatal vitamins, at least for the first 3 months, and then after birth, switching to multivitamins. It's even more important when you're breastfeeding to make sure that you're having your supplements. Some people also recommend something called brewer's yeast for fatigue, which is a source of B vitamins like B12, and it reduces tiredness and supports a healthy immune system. Exercise is the best therapy. It's the cheapest medicine, and it's by far the best cure for pretty much everything. Exercise helps boost your energy and your mood too. So something really light for new mums, like a 20 to 30 minute walk before midday every day, is just the right amount to start out with, and great to get fresh air and a change of scenery with or without your baby. I am a big advocate of routine. I honestly would choose routine every single time. Building a routine into our lives has had an immense amount of benefits, not just for me, but for my husband and my children. Having a routine doesn't necessarily mean things like sleep training and all that jazz, but it can be things like just working on baby's circadian rhythm. So gently, making bright lights during the day and blackout blinds at night, monitoring their schedule, foods at regular times, and just committing to that so that you can have some consistency to live by. I personally made a lot of sacrifices in order to get my family on a schedule, which I think has immensely paid off. Please remember that if your fatigue is persisting a little bit longer, let's say over 3 months, or you're tired beyond what you'd expect, or you have any other symptoms of being unwell, either mentally or physically, then please remember to check in with your GP, who can do things like booking blood tests and look for iron deficiency or anemia or thyroid disease, as well as doing a depression screening and just checking you over. So I hope that's been really helpful. Please share with any new or expectant moms and try and provide them with support wherever you can. Thank you so much for listening, and I'll see you next time.